Hello, I'm Dr. Nancy Muller, Executive Director of the National Association for Continence, and I'm happy to be here with you through this presentation as part of our bladder health awareness campaign. I hope after a few minutes you'll be able to take away some interesting and helpful tips for your own bladder health. Let's get started. First of all, it's important to understand just what the bladder does, what it's made of, and how it functions. It's important to understand that the bladder is really just a holding vessel. It doesn't produce urine, it holds urine. The urine is actually produced by the kidneys. And there are tubes that run between your two kidneys to the bladder. The bladder is hollow. It's stretchy too. It's actually just one tough muscle, a very thin layer of muscle actually, and it lies behind your pubic bone in the very, very lowest region of your body. And the bladder stretches as it fills. It's elastic. And then when it's time to empty, the brain can send a signal down to the bladder to contract. And the bladder, as it contracts, it squeezes urine out. And that urine passes through the urethra, which is a tube that runs to the body's outlet. In men, the urethra actually runs through the center of the penis. Most people don't think about their bladder very much. In fact, there's really no reason to think about your bladder unless you're having problems with it. However, it is important to understand how your bladder functions and how it's supposed to work when things are normal so that you can recognize symptoms when things start to go wrong. And the reason for that is that some symptoms, particularly in women, can start to happen gradually, maybe after the first baby, and then later in life reappear actually and become much more serious and severe. And incontinence can actually become not only costly, but it can contribute to sleep deprivation, embarrassment, social withdrawal, depression, stress, and sexual dysfunction. So let's understand more about our bladder health so we can stay in control. As simple as the bladder is in its construction, there are complex reasons for which bladder control problems may occur. And the problem can be in the bladder. For example, the bladder may fail to store urine as it should, or it can't push it out. It doesn't contract fully. The problem can occur in the sphincter muscle. That sphincter muscle is that tight little muscle at the base of the bladder that relaxes and opens when the bladder empties, but it also squeezes tightly shut when the bladder resumes filling, when it's operating properly. The problem can occur in the spinal cord, and depending on where that happens, it can also dictate what kinds of symptoms surface. And the problem may be actually in the brain. Either the brain is failing to send the signals or the messages that it needs to the bladder to function when it needs to, or it's unable to receive and process signals from the bladder. There is a wide variety of reasons that bladder control problems can begin occurring. And problems can occur to both men and women at any age really. About a third of the Americans believe that as they age, they're just naturally going to lose control and become incontinent, that aging naturally leads to incontinence. And that's simply not true. While aging doesn't necessarily mean a person will become incontinent, however, the aging process does put certain risk factors into play. The bladder begins to lose some of its elasticity and contractibility. It doesn't squeeze that urine out as efficiently as it does when it was younger. Pelvic floor muscles that support the urethra and the other pelvic organs become weaker. And there's limited mobility. You simply can't get to the toilet as fast. But there are also other factors. There's diet, there are neurological problems or diseases or injuries that could occur. Menopause itself is a factor. And then there's benign prostatic hyperplasia, BPH. That's a big term. That's simply an enlarged prostate. And as men grow older, their prostate does get bigger. And that can actually block the bladder's outlet and prevent the bladder from emptying completely. Just as there are different causal factors and different ways that our bladder can be affected, there are actually different types of urinary incontinence. There's stress urinary incontinence, and that occurs when leakage happens upon any sort of physical exertion, coughing, sneezing, laughing, any sort of downward stress or pressure on the bladder. And then there's urge incontinence, and urge incontinence is actually part of overactive bladder symptoms. And overactive bladder is that urgency, that frequency of urination, that gotta go set of symptoms that occur. And then there's mixed incontinence, which is simply a combination of urge incontinence, or losing that urine when you're rushing to the toilet, and stress urinary incontinence. Women are much more likely to experience mixed incontinence than men are. As men and women both get older, however, they're equally as likely to experience that urgency of symptoms. And you may hear about other types of incontinence. Sometimes doctors may even talk about overflow incontinence, and that's actually somewhat rare. It really occurs when the bladder just overfills and it just starts leaking urine because it's too full. What's usually going on there is that there's some sort of either blockage, like an enlarged prostate, or some sort of neurological damage, and the brain isn't getting the signal that it needs to empty, in which case the bladder actually becomes distended or permanently stretched out of shape. When that happens, it may mean a permanent catheter, indwelling catheter, is the only way to empty the urine from the bladder. In order to maintain a healthy bladder that's fully functional, or to begin to reverse some of those early symptoms of problems, there are things that you can do, and those are referred to as behavioral strategies. They are a form of treatment. One of the most important things you can do are those pelvic floor muscle exercises, and really you need to do those throughout your lifetime to maintain not just good bladder health, but sexual vitality. And through regular exercise, you can either build or regain strength of those pelvic floor muscles that are so important to supporting the urethra. Dietary changes can make a difference too. You may find that eliminating caffeine, alcohol, and even artificial sweeteners can make a difference, particularly in that urgency or frequency of urination that you're experiencing. Weight loss has also been found to be a means of very positive intervention. In fact, researchers have found that overweight people who lose just 10% of their body weight decrease their incontinent episodes by as much as 50%. That's great incentive. There's no better form of preventive health care than being in touch with your body and being able to recognize symptoms when things are not normal. And a lot of times we get questions about whether it's time to go to the doctor, and many times people think, well, when it gets bad enough, I should go to the doctor. Well, here are some suggestions for when you need to get serious about making that appointment. When you're routinely leaking urine, when you find that you're frequently, urgently needing to rush to the toilet almost without any warning, when you get frequent bladder infections, urinary tract infections, certainly more than 1 or 2 a year. If you have pain, if you experience pain as your bladder is filling, or pain upon or burning upon urination, you may have an infection. If you have difficulty starting to the flow of urine, and you have difficulty even emptying your bladder, that could definitely be the sign of a blockage that needs to be taken care of. There may not be anything wrong with your bladder, but you may need to get the doctor for your prostate if you're a man. Any sort of change in urination habits may be a signal for going to the doctor. Certainly, your primary care provider is the best place to start, but not everyone's doctor has a special interest in talking about bladder control problems. They might not even be comfortable because they either don't have a special interest in that, don't feel they have the time, or that they're really not sufficiently knowledgeable to talk to you about the problem. If you sense any of that, ask to be referred to a specialist. Well, what kind of specialist should you see? A urologist is a surgeon who specializes in the lower urinary tract of men and women. Many urologists have gone on to specialize in female urology. Urogynecologists, on the other hand, are OB/GYN doctors who've gone back and done a special fellowship to become surgical specialists with that training to evaluate and treat urinary incontinence, pelvic floor disorders, any sort of pelvic organ support problem like a fallen bladder, and other female bladder health issues. Some women don't live in an area that's large enough to have a urogynecologist or even a urologist who is specialized in female urology. They may choose to go speak to their gynecologist, and there are gynecologists who specialize in not just the reproductive health of women and general pelvic health, but who really do focus more on the later years in a woman's life. Geriatricians are internists who specialize in treating older people medically, may have advanced training in this area. And then, of course, there are nurse specialists, psychologists, physical and occupational therapists, and other specialists who may have training to help you. The point is, help is out there, experts are out there, and if bladder control problems or issues are compromising your quality of life, causing you embarrassment, causing you isolation, you need to get to an expert. There's simply no question about it. You have to become your own health advocate. You have to arm yourself with information that you can use that's going to be relevant to your body and to your symptoms. You better get organized and prepare for that first appointment. Write down your symptoms so that you can talk about them, particularly if you're feeling a little uncomfortable or a little unsure of some of the words or terminology to use. Keep a bladder diary. You can find one on our website. Keep a diary for 2 days, recording what you drink, when you go to the toilet, when you have an accident, what you're doing when those accidents occur. That will help your doctor tremendously in getting a good diagnosis, an accurate diagnosis, and a timely one. Most of all, find an expert and get NAFC's help in looking for an expert. Thanks very much for listening. This concludes our program, and I hope that it was informative and helpful to you. Do you need additional information or help? Don't hesitate to come to NAFC. You can email us your questions to our health educator, member services at nafc.org, or visit our website. There's plenty of content there and plenty of help. Keep that bladder healthy and strong.